हेलो गुड मॉर्निंग, मैं ऐसे डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के नेफ्रोलॉजी सेक्शन के सम इम्पोर्टेंट एमसीक्यू। अ 42-year-old फीमेल प्रेजेंट विद अल्कोहल ओवरडोज, शी इज कोमाटोज, द यूरिन dipstick showed 3+ for blood but urine analysis was normal, ultrasound abdomen was normal. What is the most likely diagnosis? Hypothermia, alcohol hallucination, rhabdomyolysis, acute intestinal nephritis. Here the answer is the rhabdomyolysis, because in the setting of the drug of overdose, the patient has presented hypothermia and deranged kidney function. The keyword of this question here, the urine dipstick test showed 3+ for blood, and the urine analysis was normal, microscopy is normal. That implies that myoglobin in urine is giving the false positive report for blood detected by urine dipstick. What is the rhabdomyolysis causes? Traumatic crush injuries, excessive exercise, heat stroke, alcohol intoxication with prolonged immobility. Next question. A 30-year-old male with type 1 diabetes mellitus present to ER with palpitation and weakness. His random blood sugar is 280 mg per dl. ECG was performed and there are tall talented T wave. Which of the following factors are causing these ECG findings? ACEI, acute kidney injury, insulin deficiency and all. Here the answer is the all, because the alternative T wave on ECG are due to a hyperkalemia caused by the effect of ACEI and AKI and insulin deficiency. Causes of the hyperkalemia क्या क्या हो सकता है? Pseudo hypokalemia, cellular redistribution, mineral acidosis, hypertonicity, insulin deficiency, beta blocker, impaired cell uptake for potassium, alpha adrenergic stimulation, hyperkalemic periodic analysis, cell injury, and excess intake, almost always in setting of impaired renal potassium excretion. Decreased renal excretion कैसे होता है? In decreased distal delivery of sodium, oliguric renal failure, mineralocorticoid deficiency and defect of cortical correcting tubule. Next question. A 56-year-old male present to the emergency department with complaint of shortness of breath and fatigue. The physician notices that his legs are also oedematous. He also a 20-year long history of hypertension. His lab reports show low calcium, elevated phosphate, elevated parathormone and elevated alkaline phosphate. What is the diagnosis? Vitamin D deficiency, chronic kidney disease, Den disease and Fanconi disease. Here the correct answer is a chronic kidney disease, because a condition known as the chronic kidney disease CKD. One is what the kidney get damaged and are unable to filter blood as effectively as they should. As a result of this, what we can extra fluid and water products from the blood remain in the body, which can lead to a variety of severe health issues, including coronary heart disease and stroke. Other health issues that are arise as a result of CKD, and the other health issues that can arise as a result of CKD include the following, like that are reduced quantity of red blood cells, also known as the anemia, an increase in the number of infectious, a diminished appetite or decreased food intake, a depressive state, a decrease in quality of life is also affected. Next question. A man undergoing hemodialysis for more than 5 years, he recently developed dementia. What could be the probable cause of dementia? Aluminum toxicity, uremia, cerebral amyloid, angiopathy, beta amyloid deposition. And the answer is the aluminum toxicity, because the patient undergoing a long-term dialysis, acquired dialysis dementia. Aluminum seems to be a demonstrated toxicology concern people who have chronic renal failure. In this patient, the accumulation of aluminum in tissue causes an encephalopathy known as dialysis or encephalopathy, or dialysis dementia, a specific form of the metabolism bone disease known as osteomyelitis, dialysis or osteodystrophy, and anemia. And aluminum accumulation also plays what an etiological role in some of the other complications that are associated with the end stage chronic renal disease. The buildup of tissue that occurs in chronic renal failure is caused what? Malfunction in the normal excretory process of the kidney. obviously. And patients with chronic renal failure who develop ammonium toxicity are almost always receiving long-term treatment with either hemodialysis or peritoneal dialysis. And if a patient with chronic renal failure who develops aluminum poisoning tend to get the majority of their exposure to the metal from the dialysate diazolate which contain aluminum, and defroxamine, a chelating agent, is effectively if it is given early. And next question: which of the following is not a opportunist infection in such patient in the early 1 to 6 periods? CMV, hepatitis B, polyomavirus, and hepatitis C. Is the answer is the polyomavirus. In this stage of the renal disease is a medical illness, whereas the which a person's kidney cause functioning as a permanent basics, resulting in the requirement of either regular course of a long-term dialysis or kidney transplant in order to preserve life. Like that, the opportunistic infection in renal transplantation. In such patient, here we the renal transplantation, like the patient who have the undergone a renal transplant also given immunosuppressant to prevent graft tissue rejection. Therefore, he is prone to opportunistic infection within the first month after transplant. The patient can get surgical site infection with MRSA, and in the early period of first 6 months of the transplant, the patient can get infected with pneumocystis jirovecii, cytomegalovirus, CMV, hepatitis B, and hepatitis C. And next question: a 56-year-old male with aortic stenosis present to the emergency department with complaint of shortness of breath 2 days ago. He also had a history of dyspnea and fatigue after taking a salty meal. No other significant past medical or surgical history is present. On examination, he has a blood pressure of 95 by 60 mm, a heart rate 110 beat per minute, jugular venous distension, crepitant rails at the base of the lungs, hepatomegaly, and oliguria. Which of the following drugs can be used in such patient? And the jugular venous distension, crepitant rails at the bases of the lungs, hepatomegaly, and oliguria. Which of the following drugs can be used such patient? Insulin, NSAID, ACI, and ARB. ये क्वेश्चन का आंसर आप लोग कमेंट करके बताएंगे. मैं हिंट दे देता हूँ कि अगर पेशेंट है विद आर्टिक स्टेनोसिस प्रेजेंट विद सिम्टम्स ऑफ शॉर्टेज ऑफ ब्रीथ एंड हिस्ट्री ऑफ डिस्पेनिया एंड फैटिग after consuming a salty meal, these symptoms could be indicative of fluid overload exacerbation, the underlying of the cardiac condition. Could be a fluid retention and exacerbating the underlying the cardiac condition. Please comment your answer. Okay, thank you. That's all, and keep revising.